good standing to mention that.
Okay, thank you. Should we tell them that that 13 is in here? Oh, never mind.
Come in.
Ready? Good afternoon. I'm Dr. Sandra Martelli, the Public Health Administrator for Winnebago County. And today I'm joined by Kim Nelson, who's the Executive Director of Early Childhood Education for RPS 205, and Mayor Tom McNamara. So kind of to do some introductory remarks, last week we ended on some hopeful news about vaccination. So our vaccination plan for Winnebago County has been submitted. I want to remind everyone of the general principles, because you're hearing more and more coming out from the national media as well, is that local health departments will oversee allocations of vaccine as they come into the region. We expect that the Pfizer product will be the first to receive what's called the Emergency Use Authorization. We're probably going to be all good at all these acronyms, EUAs. And yes, this initial vaccine supply will require super cold chain. So I've been asked many times, do you have freezers? Do you need this? They will come in their own freezer containers. And again, we expect to be able to use them in the time frame allotted so that nothing will require additional refrigeration. And of course, the probability that multiple products will become available as time goes on, because we know Moderna is kind of following closely behind that. Yes, it will require 2 vaccinations, right now 21 days apart. And we understand, and it's important to report, that limited quantities would be available to start vaccination efforts. So we keep hearing about when am I, what group am I in, when can I get it? It will be a slow roll. Initial prioritization will include healthcare providers, and we understand that residents of long-term care facilities. At present time, because it's coming under the emergency use authorization, vaccinations will be voluntary, and it will require a consent process. So I want people to understand that it's going to be a phased approach. It's important to understand that this initial and early rollout will be very limited in scope. Some of the key points to take away, though, as we discussed last week, there's going to be multiple phases. Everyone who needs a vaccination will receive a vaccination. There'll be priorities within the phases. So you may be asked additional questions. So when we say healthcare workers, that may not mean everyone in the hospital day one. They'll be further prioritized within those settings. We will have multiple models for vaccination depending on the phase and the priority groups. Whether it's closed point of dispensing, meaning it's in that work environment or that setting, so a long-term care facility or a hospital or clinic. It might be what's called an open point of dispensing as we get further into the system where we may have the population come. It might be a semi-open, where we might sponsor it in a particular zip code or location of concern, and then again with some registration. Our retail pharmacy partners, and of course private providers in the community. But while we're hopeful and optimistic that the vaccine is coming in, there'll continue to be a need for non-pharmaceutical or social mitigations. You start seeing the term NPIs, non-pharmaceutical interventions, which really are the social mitigations. So yes, we will continue to have to mask, we will continue to have to social distance, and we will also have to have frequent hand washing. And of course, we will have to limit our contacts outside of the household. So even though this vaccine is coming mid-December, and I've heard a lot of optimism, does that mean that the holidays can be open? The answer is no. We will continue to have to practice all those things that we had to do to keep our population as safe as possible. We also heard a little bit about some new changes in quarantine that may be coming out. Post-holiday gathering, if you engaged in crowds for Black Friday shopping or had a college student return home, or you had members outside of your household for Thanksgiving, consider testing 5 to 7 days after the exposure. Testing sooner than that may result in a false negative result. So if your college student didn't leave till a little bit later, think about that 5 to 7 days. But it is still recommended that you continue quarantining for 14 days post-exposure. The Centers for Disease Control and Prevention provide some additional qualifications to quarantining that we're learning about. And that includes asymptomatic individuals at day 10 of quarantine, if they are asymptomatic, meaning they have not developed any symptoms, may be able to return. An asymptomatic individual with a negative test performed within 48 hours at day 7. We are working with the Illinois Department of Public Health on these guidelines because, again, we want to make sure that we are implementing both as a region and a state. So at this particular time, the Illinois Department of Public Health has not issued new guidance, and we are not changing our best practices until further notice. So if you are quarantining with us right now, please maintain your quarantine. 14 days is our current process. But I have to remind everyone that guidance is changing as the science provides additional information on best practices. When we think about that, we're learning more as we go through the contact tracing process. The honesty and the information that people are providing, the symptom check-in that they do, has helped to inform this process, as well as we've had increased access to testing. We couldn't make a testing recommendation earlier in the pandemic because we didn't have the access. So things are constantly evolving. So we appreciate the public's support and continue check-in with us. If you have a question, please don't come out of quarantine or isolation unless you've checked with us. We talked last week about the importance of children, especially helping to manage expectations and their social emotional health during the holiday season. So I've asked Kim Nelson, who's the Executive Director of Early Childhood, to give us some pointers about how we can work with our children over the next several weeks as we prepare for the winter holidays. Ms. Nelson?
Okay, thank you, Dr. Martell. So this year is going to be a little bit different for our young children and families, and we know that. And so to help prepare our young children so that they can celebrate and keep the magic in the holidays, we just want to share a few ideas of things to do, basically starting some maybe new quarantine safe approved holiday traditions with your family. And it's really important for young children to be sure that you include them in the planning. Young children really do benefit from having some choice and some control that will help eliminate some of the social-emotional behavior challenges that may come up. So for example, you may want to venture out and have your children plan their very own holiday show. They could become their own TV personalities. They could do songs, dancing, do their own do-it-yourself craft for grandma. Go ahead and video those and share them out. But if you're really adventurous, have that a virtual live show, because I'm sure your families and friends will really enjoy that. You can have your children make decorations, cards, and gifts. And instead of those in-person visits with families and friends and that all-important Santa, consider ways to video chat, or more importantly, get back to writing that very important letter to Santa. Stay positive yourself and get really excited about all of the things that you still can do and put your energy into those things. Have your children help decorate your home. Drive around town and look at all the holiday decorations. Take a walk at Sinisippi Gardens and look at the lights. I drove by last night. They're beautiful. Plan a movie night and watch your favorite holiday movies. Young children really do love to cook, so make holiday cookies to share with families and friends. Children may even have fun being the elf and dropping them off safely on doorsteps. Create your own workout to holiday songs. Have your child pick their very favorite holiday song. Each family member can choose a move, jumping jacks, squats, or just plain old silly dancing, and have them do that for 20 seconds to their song, take a 10-second break, and do the next move. Continue to rotate until the song is over, or more importantly, until everybody is tired. You can even take a current tradition and give it a little pandemic twist. For example, if your traditions include that elf on the shelf, you may want to have your elf quarantine for the recommended 10 days because he's been out with other elves before he starts those daily check-ins. And then once out of quarantine, have him wear a mask so he's safe when he returns back to the North Pole. Ideas to quarantine your elf may include a box or even a clear jar. If you notice that your young child is feeling sad, let him or her know that it's okay to feel sad and disappointed that they can't do something, one of their favorites this year. Encourage them to share their feelings, and you share the things that you're doing to make yourself feel happy. Find the positive and teach that positive self-talk. For example, since we can't see Grandma this year, let's draw her a picture of all the fun things you want to do with her once it's safe to play again. The National Center for Pyramid Model Interventions websites has several great resources to support families in helping young children cope with challenges that they might encounter during stressful situations. Parents and caregivers, be sure to manage your own disappointment about this holiday season. Allow yourself to feel sad, worried, or angry. Do something to nurture yourself, adjust your own expectations, look at that big picture, and most importantly, remember that our children take cues from us. If you maintain a positive, festive, and calm demeanor, your children will pick up on that and do the same.
Thank you, Kim. I was certainly taking notes of what new things that we can do with our young kids. I have a 3- and 4-year-old, and I'm very pleased to say I get a live dance party every evening when I get home, and I'm thrilled that they have my wife's dance moves and not mine. So I think most people who see them will be thrilled that they have her dance moves and not mine. But on a serious note, Kim, thank you, your entire team, everyone at the school district, everyone at all of our schools, public and private. Working in the education sector during good days pre-COVID is really a difficult task. Doing it now with remote and physical, or just remote, whatever it may be for each different school, is really a remarkable challenge, and one that all of our teachers across our community is just doing a wonderful job, and all of the staff, not just teachers. So thank you. So we as a community continue to face many challenges due to COVID-19 and the state mandated mitigation efforts that are there to reduce the spread of this deadly virus. I want to make a special mention, although we don't have a lot of time, but make a special mention for our struggling businesses. We have extended the deadline to this evening at 5 o'clock to apply for funds from the restaurant and bar industry. We have a $900,000 pool of funds available to grant out up to $7,500 per establishment. To date, we now have over 90 applications. Our goal is to fund all of those establishments and work to obtain additional dollars, as we know that $7,500 is simply not enough. Also, our residents are struggling as well, and at the city, just since August, our Human Services Department has done an incredible job. They have assisted more than 5,860 residents with nearly $3.5 million towards utility payments. And in the month of October alone, we have assisted in repairing or replacing more than 40 furnaces in the city of Rockford for those in need. I also want to say a special thank you to the YWCA today for their efforts in securing a grant from the United Way of Rock River Valley COVID-19 Emerging Needs Fund. With these funds, YWCA created the Winnebago County Restaurant Workers Relief Fund. Within just one day, this will highlight the tremendous need that is out in our community. Just within one day, the YWCA received so many applications that they had to stop accepting new applications. So I just want to say a strong thank you to the United Way and their Emerging Needs Fund, but also specifically to the YWCA, because it's just so great to see these organizations step up when there are so many people in need throughout our community. So as you'll hear and you've been seeing over the last 10 days, we're starting to see some form of a flattening of that positivity rate. And I say that hesitantly over the last 10 days. But again, today you'll also hear really sad news that we've lost more lives to COVID-19. So with some setbacks, we also have seen small signs of positivity, but we need to, I hope this doesn't let anyone put their guard down. This is the time that we all need to continue to be vigilant. We are all getting tired, but those who are probably getting the most tired are healthcare workers who are really on the front lines of this battle against COVID-19. They're tired and they need our help. We need to do everything that we can individually and collectively to help slow the spread of this virus, and that means to all of us avoid gatherings, especially now as we're transitioning fully into the winter holiday season. I also want to mention I have the opportunity to host a weekly meeting with fellow mayors and presidents of different villages throughout Winnebago County. We need to, as mayors and presidents of these different villages and cities, continue to enforce the increased mitigation rules and help keep our residents and our visitors safe. Our efforts, and this is critical, our efforts are far more effective when we all implement these efforts together. The health of our citizens and the health of our economy are intricately tied together. Working together, we will make our citizens healthier and our economy will recover more quickly. So while the next few weeks are certainly going to continue to be difficult, there is some good news on the horizon. We are seeing and hearing more about vaccines and our plan to vaccinate our population. And as we've referenced before in different press conferences, we are in a marathon, and throughout all of this marathon, we have often not seen the light at the end of that marathon. I don't know if we've seen the light yet, but we certainly can see that glimmer of hope that is out there. And we together, if we continue to work together, and we continue to take care of one another, we can certainly finish this race strong and in a good position to rebuild our communities. So let's be smart, let's work together, let's wear our face covering, let's practice social distancing, avoid those gatherings, work remotely when you can and where you can, and wash your hands frequently. And with that, I'll turn it over to Dr. Martell and thank her again for her leadership during this difficult time.
So thank you, Mayor. So today, the number of new cases we're reporting are 79. And while I'm cautiously optimistic that the number of cases is continuing to decline, remember that reflects testing over the holiday weekend. And I don't think that was always the first item on everyone's mind as they celebrated. This brings our total cases in Winnebago County to 18,804. And again, sadly enough, their cases are among 3-month-olds to 96-year-olds. So it is not sparing any one age group in our community. And as the mayor alluded to, we lost 7 additional residents of Winnebago County to COVID, which brings our total deaths currently reported at 264. And again, as we talk about these numbers, they represent people and people in our community that we have lost, loved ones, parents, grandparents, siblings, colleagues in our work environments. And we must remember that as we go through all of this and we look optimistically to the vaccine, that it's through this pandemic we have lost a significant number of our residents. Our testing positivity rate is at 15.7%, so we are flattening, as the mayor would indicate, and our original positivity rate is at 15, but nowhere near the 6.5 that we were aiming for to come out of mitigations. So it does require all of us. The hospitals are reporting on Monday that there were 169 hospitalizations due to COVID-19, and unfortunately that's up by 3 since last Wednesday, which is their report dates are usually Monday and Thursday. So while we continue to really work hard to get our positivity rate down, our total people needing hospitalization continues to remain stable. That means they haven't had to increase number of beds currently, but they're having to staff those increased beds they put into place at the start of this. Our recovery rate is at 98%, and we have one new location of concern, which is the TLC Community Learning Center. And I'm sorry, it's TLC Community Living. My apologies. But I wanted to thank Kim for her work. I think that one of the areas that's been near and dear to all of us as we've talked about this is the importance of that social emotional learning and the commitment we had made to keeping our schools as much as possible in some kind of in-person and or, as we pull through this next phase, remote learning to ensure that we are giving our children everything they need. They are our future. And I, come back to, if, as a community, we've got to support the efforts. So whatever you can do to help another family, if you see maybe you can be the little face in the window that visits a child on a porch. Maybe you can be the one that decorates to let them come by and see. And yes, you can let them do a socially distanced visit and let them leave a cookie. Or maybe you can volunteer to help answer one of those letters that comes from so many of the children now that are not getting those in-person visits from Santa or with their senior citizen grandparents. So it becomes important. If you can be that person, socially distanced and remote, that would be great, because we need everyone on board to get us through. So we're in this sprint phase now, which is we're starting to see some vaccine. We're starting to see some positive changes that we can go move forward to, but we are all going to have to pull together in these final months, really, because when you talk about it, we're 6 or 7 months away from everyone potentially being vaccinated. So we're going to have to continue to wear face coverings. We're going to have to continue to social distance. We're going to have to continue our frequent hand washing and really keep our households and contacts low. So with that, I'm happy to take any questions.
Dr. Martell, can you speak back to the hospitals and how certain people in the healthcare field will get vaccinated sooner than others? I'm just wondering, what does that look like? Because say someone who needed more than someone else that day, they're out because they took the test and they're side effects. So how are you guys going to kind of determine who on each schedule each day gets it versus who doesn't? Does that make sense?
Okay, the question is about prioritization within the priority groups, right? So again, we've kind of talked about this and in a little bit of kind of understanding this. So within, let's say you get 100 doses, and please do not quote on any particular number. I'm going to go with an easy number that I can do the math on. Within a hospital setting, they may have individuals, they may have 200 people that need a vaccine on that week, that day, that it arrives. So they're going to, within that 200, identify those most at risk. So it could be those in direct patient care on the COVID units. It could be healthcare providers with underlying health conditions that put them at increased risk for complications associated with the infection. But each hospital, each healthcare entity is working through that prioritization. And you know that that will not be easy. As we know, it's never easy to have a limited resource and say, you're not first today, but we will get to you. And understand that the commitment that everyone is making is that we will get to it. But we are going to have to prioritize. And we can't, I also want to urge the public not to make judgments about how the prioritization is working. Why is one individual getting vaccinated today and another is not? Because again, they may be looking at those underlying health conditions and risk factors, even within the healthcare system. Does that answer your question? Okay.
Dr. Martell, we talked a lot last week about the vaccines within the county and what that might look like with all the different pods, the different phases as well. And so my question is, have we done trial runs as far as what that might look like with drive-throughs?
The question was, have we done some of these trials with the drive-throughs? So we held 3 drive-through points of dispensing clinics for the flu vaccine. We held one at the Winnebago County Fairgrounds out in Pecatonica, one at Northtown Mall, and another one at our apartment parking lot to do the vaccination. And we were able to do some of our throughput studies, what worked, what didn't work. What we found was, though, we vaccinated more through that influenza model than we had in previous years. So the general acceptability for individuals was that, one, they're in their own quarantine vehicle, so to speak. They're with their own household, typically. And then the second part is for people with mobility issues and concerns, an automobile may be a way to vaccinate those who cannot mobile or not as mobile as they'd like to be.
Is there any thought of maybe the second round of prioritization would go to, like, perhaps?
Okay, right. You're starting to hear about phase 1A and phase 1B, and of course we are also, as the Illinois Department of Public Health, and we're reviewing all the FDA. Phase 1B, so for instance, long-term care facilities have been kind of debated back and forth, right? It's being vaccinated. But remember, the healthcare workers have to be vaccinated to provide the care. So that means maybe first responders and public health workers will be in phase 1B, because we're going to try and get our most vulnerable at risk based on what the guidelines are coming out for this vaccination to get that into them as soon as possible.
And do we yet know, I know last week when we had touched on all those different kinds of vaccines, there's 2 different kinds, and we had touched on what it would look like coming here to the health department. Do we yet know how the number on those vaccines yet?
The question is, do we know the number that's coming yet? No, we do not. But I want to assure everyone that we will make sure that everyone who needs it vaccinated will get vaccinated. I think the other part is we do a lot of proration. So it'll be in proportion, right? So one system may get a different allotment than another, and it's not because we have a preference for anyone. It depends upon the number of staff involved or caring for and number of their disease burden within their facility. So they related.
And I don't know if we have touched on this already, but do we have an estimate as to when we could see this starting to actually roll out and when these vaccines could be coming our way?
So the question is, do we have an estimate of the timeline or time frame? I think the media is probably reporting it more accurately than we can probably get it. We understand somewhere mid-December, so we're, you know, again, I don't want to give an exact date because, again, we don't want people running around chasing the vaccine around. We understand it's going to come out mid-December, whether that's the 10th, 11th, 12th, 13th, but we are planning to be able to start in mid-December.
And is this going to be optional for everyone, or, like, I mean, just in terms of, like, healthcare workers, for example, will they have to do it, or?
Well, the question is, will the vaccine be mandatory, I think is the question. And again, we are under, this vaccine is being released under what's called an emergency use authorization. So I think most employers are looking at whether or not, I mean, they're certainly going to highly encourage vaccination of healthcare workers, but I think that will change as time goes on, and as the vaccines have more information behind them, then if the emergency use authorization is withdrawn and it's just out like we would with any other consented vaccine, then you may see employers responding differently.
Dr. Martel, we had also talked about how when it does eventually get to that phase where it is open to the general public on really focusing and honing in on those communities that you have a higher rate, focusing on communities that have a higher mortality rate as well. But we understand that African Americans are more at risk. It's also understood that a lot of African Americans that when thinking about this COVID-19 vaccine, they might opt not to take this vaccine. So when considering communities that are at higher risk, that are higher in African American communities, maybe what would be a solution there if there are a lot of people within that community that are opting not to take it?
Well, first of all, I think part of it is we do have a group that's working just on communication, both at the national level, the state level, and at the local level about how to address, I'm going to say, myths, concerns, and frequently asked questions, right? Like, you know, I think we talked to you a little bit about the flu clinic. What we learned from some of our data said one of the big concerns was, you know, is it safe? Is it effective? And is it going to cost me anything, right? And so we know we have to address those. We also know that the clinical trials have involved people of color. I think this was extremely important to include. And we will also be working with some of our influencers in our communities to, as we get that out, you know, part of any campaign is to get those influencers to get out, get vaccinated. And it's very important as we move through this that people understand and trust this vaccine is going through very rigorous testing. And again, with the understanding that the FDA is reviewing all the information, we heard that the UK approved it for its first rollout as well. And the European Union is also working through that process. So as time goes on, I think people, again, as they begin to understand, as they know people who get vaccinated, most people know their influencers are probably not someone even that they see in the media. It's probably someone, a trusted family member, or, you know, that's got the vaccination. I mean, how many of you probably even thought about this year with flu, right? If it wasn't mandated at work, did you know someone who said, you need to go get vaccinated, you're out in the public? A lot of people we met, I would say anecdotally through the drive-through that I got to talk to, said this was their first time. They hadn't thought about it, but this year they were thinking about it because someone in their family may have had COVID. Someone in their family may have had flu last year, and they didn't want to risk it this year.
Who are some of the community partners that are working to just kind of create that overall awareness to let people know, especially in those underserved communities, you know, this is what's going on, this is what you guys need to do, because you can't assume that everyone's watching the news or, you know,
right.
things of that nature.
So the question is, who else is included? Well, that group is led by our Public Information Officer and our Joint Information Center that is comprised of members and representatives from various entities, from their public information officers, as well as then influencers in the community. We had a group called Communities of Concern that have done the porch walks, have been involved and engaged since the beginning of the pandemic to do direct outreach into those communities. And obviously we want to include them in any development of any materials that are specific that they want to put out in their communities.
Going back to the timeline, if it were to start in mid-December, do we kind of have a rough idea, or was it guessing at this point how long it would take to basically vaccinate the bulk of the population?
So the question is, knowing that this vaccine is rolling out mid-December, do we have any timeline for complete vaccination of the population? Well, again, we're looking at the same information that you're all looking at. Again, as more products come online, we understand there are more vaccine potentially coming out. And as the production matches up, you know, that we probably won't see general population until the spring. So that may take us spring to early summer. And so, again, there's no hard and fast, you know, it depends upon how well the vaccine is, you know, managed, if it's produced, and again, getting it into the arms of individuals. And our goal will be to try and get it out as quickly as we receive it to the populations most at risk.
Has this been tested on pregnant women yet?
The question is it approved yet for pregnant women? Pregnant nursing women under the age, or individuals under the age of 18, it has not yet been, that will not be part of the included risk at this time. Now that may change as the FDA looks at the information, as they review the data tomorrow. They're really kind of in that process right now.
Changing gears a little bit, we had also talked about enforcement on certain businesses. It is this past weekend was Black Friday. We also had shopping. We have been shopping over the holiday weekend leading up until Christmas as well. And so thinking a little bit about that, we do understand that we have been in communication with a business in Roscoe that was fined for $750 through the village of Roscoe. Mm-hmm. And so we are just wondering, as far as with that being a government agency, if you know about other businesses that are also in that kind of same position where they're getting fines, but not exactly through the health department.
Okay, the question is, our businesses, and again, we've highlighted this a little bit about, you know, the health department has most of its mitigation and efforts around food establishments where its authority really rests. The capacity limits and concerns we typically enforce with the villages because they may have different codes that allow them to issue fines or levy based on their business license versus their ordinances or codes. And so they inform us when they're doing that. We're monitoring all of the complaints that are coming in. It's unfortunate that this far into this that we haven't really gotten the message about the dangers or concerns we have about crowd gathering. I know that most of the merchants and retailers on Black Friday, they continue to have sales. My email box, my personal email, is inundated with that kind of stuff right now. The idea being to shop online and shop safely. I understand that some individuals feel like, they need that personal experience, but again, taking a look at doing it off-peak hours. But if businesses aren't making sure the capacity limits are upheld, that puts the public at danger. And I know the city of Rockford has done. Did you want to speak to that, Mayor?
So the question was about enforcement?
Yeah, I guess an update. I mean, the one that I had about the Village of Roscoe is basically those other municipalities other than City of Rockford Health Department. No, that's absolutely okay. And she did answer the question, but just kind of those, if we are knowledgeable and aware of other villages, different places of government agencies also putting out fines.
So to my understanding, right now the only communities that are putting out fines, and I would say doing full enforcement, would be the City of Rockford and Roscoe. Any follow-up or question? Okay.
Thank you.
Any additional questions for any of us? Okay, thank you. Hope you have a great day.